Hi guys, this is Dr. Bhupesh from Dr. BKM OIT Institutes. Thanks to the people who have created this question paper. Again, being Dr. BKM Institutes, we focus majorly on how to do things. This was a wonderful question paper, and I always tell my students to make a separate box that you should say these readings I will do in the final week of the exam. Means suppose if exam is coming next week Saturday, then from Monday I will try to revise this reading. This reading is kind of that reading which should be revised. In the first question, if I say periodontal disease is unknown to, oh, sorry. First question was oral health problems have been recently linked to. Again, guys, please don't. Again, if you are listening to my lectures regularly, attending my Zoom classes, if you are our student, or if you are our YouTube floor, you can understand this word is very important for me recently. So, oral health problems have been recently linked to. So, if you do not read this word, then you will say the relationship between oral health and diabetes is well known. So then you will say oral health and diabetes is associated. Then you will see do the answer C. But please understand, our question was have recently been linked to. So when you will read the line, you will see it is not between oral health and diabetes. It is the relation is well documented. In the last decade, however, that means in the last 10 years, that means now this is recent thing. In the last 10 years, however, given support to existence of association of oral health problems like periodontal disease with other systemic diseases such as cardiovascular disease. So that means they are trying to connect oral health problems with systemic disease such as cardiovascular. Cardiovascular means heart, and that is where the answer converts gets changed from C to B. That is what you need to learn. That in the recent times, in the last decade, however, it has given support to the existence of the relationship between oral health and cardiovascular. Cardiovascular means heart. So small questions can go wrong. Again, 13th question is complex, but again, I will not make it over complex. Why periodontal disease is unknown to many Australians? Very good, very difficult question. See, please read this. Periodontal disease is unknown to many Australians. Why? Uh, I will read this line where this answer is from because we have just done this question. A very wonderful question. Adding further layer of complexity to the problem is lack of awareness. That means lack of the awareness is the reason of complexity of the problem. That means if my question would have been why this problem is complex or this problem is complex because, then I would have said because there is lack of awareness. But the question is why there is lack of awareness. Suppose if I say he did not come to the class because he has fever. So if somebody asks me why he has fever, I can't say because he did not come to the class. He did not come to the class because he has fever. I cannot say he has fever because he did not come to the class. No, no, no. He did not. So this cannot be the answer. The question is why people are unknown. So question is why there is lack of awareness. There is lack of awareness in much of the population relative to their knowledge of more observable dental disease. So one reason is that observable dental disease, they have knowledge. They do not have knowledge of the periodontal disease because it is less observable. Other two reasons are decreasing accessibility and affordability of the dental treatment. So there are three reasons of lack of awareness. One, periodontal disease is not observable. Two, there is decreasing affordability. Third, there is decreasing accessibility. Please understand this. Very easy. Now, if you go to this options, let's see how easy can we. You want to know what is elimination? This is the perfect example. Dental treatment is no longer affordable. They said dental treatment is having decreasing affordability. This did not said is not available at all. Please understand this is saying absence of affordability. Whereas the paragraph was saying decreasing affordability. That means they are still affordable, but they are affordable to less people. So no longer affordable is not right. Please understand this simple basic thing. In the same way, inaccessible means is not accessible at all. But they are saying there is decreasing. So two options you can throw out. This we have already done. High degree of complexity. We have already done when we started this question, that the problem is complex because it is unknown to Australians. The question is why it is unknown to Australians. It is unknown to Australians because it is less observable, because it is not as prominent. Prominent means observable. It is not as prominent as other dental issues. Question number fourth is 14th is very easy. This you can learn a lot. And this question, 13th question should be done in the second round if you're not good at reading. Don't worry about this question. You can do it later. Save time in the first round. Again, always the same thing. But this is a wonderful, wonderful question. 14. The most suitable heading. So what I did, trust me, when I solved this question as well, I did not do anything. I just read the first line and the last line. Periodontal disease, most severe form is periodontitis. It is inflammatory bacterial infection that destroy the attachment tissue and supporting bone of the jaw. So they're talking about periodontitis, and they're talking about what is the effect of periodontitis. In the last line also they said that often this destructive process only has very mild symptoms. So that means in the middle they have talked about the process, that how the periodontitis is happening. So overall there is a process, and then there is what is the effect. It destroys the attachment. In the last also, often this destructive process has mild symptom. Eventually, however, teeth can become loose and may have to be removed. So that means periodontitis can lead to the removal of teeth. So again, they are talking the same thing. Periodontitis, periodontitis and its effect. And in the middle, they have talked about the process. So my major answer should be periodontitis and its effect. But when I went to the option, they talked about types of periodontal disease. I know types is not given. They did not talk about treatment. Body's response to toxins can be one of the answers because they might have talked in the process, but they were majorly talking about periodontitis. So I did not think much. I simply did the topic was periodontitis. Simple. So you can make, if there would have been better, the question would have been tough if over there they would have given periodontitis and its effect. Then trust me, I would have chosen the word effect because it is given in the first and the last line. So that is the main topic, and it is given in the first line and the last line, that this is the effect of periodontitis. In the middle, there can be process. So don't go for the middle thing, go for the final thing. So that is why periodontitis has its effect. So go for that option. But yeah, in this, there was no confusion. So this question was a cherry cake walk. They were talking about the process. Simple. So then you can do further questions again. So I'm recording this recording just because of these things. Then we did one of this wonderful question, which also I would like to discuss. The research in the paragraph 3. So research study means study word. Never lose the focus of this word study. Found that. Found means result. Result means finding. What is the finding of the study when it comes to the relationship of poor dental health and heart attack? So I have to read just one line where the finding has been given. So when I went to paragraph third, so they talked about a study. So I did not waste my time. They talked about a study that happened, the control study and all that. Then they talked blah, blah, blah. I did not see. Then they talked about the result. The researchers reported a highly significant association between poor dental health and acute myocardial infarction. Means there is a significant association between dental health and heart disease. And reported means they have given a final report. So that means according to researcher, it is quite evident. That means they have report. So they have seen the things. They have prepared a report. That means they are giving an evidence that there is an association between poor dental health and heart attacks, acute myocardial infarction. But the main thing, I did this answer as B by chance. Could have done C, but at least I know the study was not inconclusive or inconsequential. The study was clearly saying there was a report that there is an association. Coincidental means they are co always means happening together. Co always means happening together. So coincidental means they are happening at the same time. So I by chance did B, which I still feel is good option as well, because they said there is a strong association. That means they will coexist. They will be coincidental, but that's okay. This is a better answer because there is a final report, so there is an evidence. But again, this answer is also good. So again, in the final exam, I don't think these two words come together, because evidence word means there should be a strong proof. So proof word was not given. So in that case, I did coincidental, that they coexist, that there is a strong association means when there is poor dental health, there is heart attack, acute myocardial infarction, that is coincidental, happening at the same time. Incident means happening at the same time. Co means together. So I did B, but at least I did not do A and D. Why can you do A and D? Because of this stupid line. The last line, if you will see, the association was independent of other risk factors. But our question is not about other risk factors. Our question was just about this line. Again, don't overthink. This is what I want to teach. Our question was this line only, that there is a strong association between poor dental health and heart disease. So you can skip the last two things. You can skip the last line. So sometimes last line will confuse you. The association was independent. So you will say, oh, it is still inconsequential. No, no, no. They are saying there is a strong association. So you focus on this line only. So that is how you do OET reading to make your job easy. This is Dr. Bhupesh from Dr. BKM OET Institutes. Again, as always, don't just watch this video one time. Watch this video at least 3 times to learn again and again what I want to teach. Thank you very much. This is Dr. Bhupesh from Dr. BKM Institutes. Thank you.